Public service announcement: the health discrepancies in the African American and Black population, as presented by Christy Jacks, Jennifer Rebon, Andrew Shin, Aaron Tran, and George Wong. African Americans remain the least healthy ethnic group in the USA. It is a result of years of racial and social injustices, along with a challenge to obtain equitable health care for all. Social development programs, economic investments in education, and the participation of African Americans in policymaking has shown to be positive health indicators for African Americans.
Racism is correlated with substandard employment, education, income, and access to health services. This leads to an increased risk of exposure to toxic substances, low-quality schooling, occupational hazards, and poor access to healthy foods. Studies show that the food available in poor Black neighborhoods are less fresh and lower in quality. In addition, alcohol outlets are more common in these neighborhoods.
This drastically increases the rate of diabetes and obesity in Black neighborhoods. The quality of housing also affects the health of African Americans. They are also associated with higher rates of asthma and cardiovascular disease. An educated and informed population will utilize the services more effectively. 40% of African Americans have limited reading skills, which affects the overall population's health literacy and ability to obtain, process, and understand basic health information.
In 2012, African Americans were 13.6% of the working population, but were not 13.6% of any major health profession. To be specific, only 5.3% of active physicians are African American, 10% of nurses, and 3% of dentists. As we know, oral health is the gateway to the body's overall systemic health. Health professionals need to be made aware of health disparities among ethnic groups, specifically in African American communities.
In doing so, they will be better equipped to provide comprehensive care towards African Americans' overall well-being and aid to develop better health policies. Government officials can help by increasing funding towards projects that increase healthy food options, better work environment, and safer living conditions for the African American communities.